To start the session, ma'am?
Yes.
Okay, sir. So, good evening, everyone. I, Dr. Shanvi Yadav, welcome you all for the today's session. And I would like to thank all our participants for showing such immense response for this course and becoming an integral part of Orbit Institute of Applied Homeopathy. This through which we are going to organize many programs, so in which we are giving the information about regarding the various disorders. And today we are very intensely happy to announce our first online certificate on the Independence Day. As we all know, India is celebrating its 75th Independence Day as an Azadi Ka Amrit Mahotsav. So happy Independence Day to all. I would like to DeepakSharma to please show the picture how Orbit Clinic team has celebrated Independence Day. This is the way how we celebrate by hosting the flag at our home at clinics. Thank you, sir. And next, I would like to introduce our chief guest, that is Dr. VPS Arora. Dr. VPS Arora is a professor at Department of Economics and International Business at Sharda University, Uttar Pradesh. Earned his bachelor, master's, and doctoral degree from GB Pant University of Agriculture and Technology, Uttarakhand. It was the first farm university of India. He served the same university 4 years as an associate professor, head of the Department of Agriculture and Economics, as well as a dean. He was the founder dean of College of Agriculture Business Management and his flagship program of MBA. He successfully undertook several
the audio system. Dr. Deepak.
Dr. Shanvi, क्या वो
My audible, sir?
Yes. Yes.
Okay. So I was giving about our chief guest. So let's begin. He has successfully.
I'm unable to.
Dr. Shilpi, please mute Dr. VPS Arora sir, as he is having the two IDs. So there is an into this from the.
I think there's an echo because there are two devices by which you have joined.
Yes.
Sir, have you joined by two devices?
Anyhow, without you, I can start.
Yes.
At the outset, I must congratulate all of you and wish you luck on having completed our 75 years of independence and the Amrit Mahotsav we are starting. So, wish you all good luck. And I also congratulate the team of Dr. Deepak and the renowned and passionate doctors who have joined this particular institute, Orbit Institute for Applied Homeopathy, to start this online program. And that too on this auspicious day. I'm sure that this particular program will benefit all the stakeholders. I'm fully aware about this Orbit Institute and Orbit Clinic. It consists of the team of passionate, professional doctors and serving the humanity. The number of people, number of the patients have been cured by them, and I have gone through the reviews. And when such a efficient, proficient team joins us and start an online program, I'm very sure and I'm convinced that the beneficiaries are going to be serve the community, serve the, again on.
Sir, we are able to hear you. We are able to hear you.
Okay. But there was some system there. So, as far as my knowledge is concerned, because I'm not a medico, but I know that homeopathy is one of the system of curing the different diseases, and that too permanently. Since my childhood and since the childhood of my children, and one of my kid is sitting here, Dr. Shilpi Arora, they have been practicing this homeopathy. This particular treatment is not only friendly to the children, not only friendly to the persons who practice it, but also affordable and does not have much side effect, as far as I know that. As far as I see the biodata and the CV of the doctors who have joined this particular institute, they are all proficient, they are all committed and passionate. I'm sure that they are going to serve the persons who will be joining for the certificate program, and the certificate program is going to benefit not only the beneficiaries, but also those who are going to be the ultimate beneficiaries. I once again wish the team of Dr. Deepak very best luck and wish them a good luck that they serve the community, and also wish good luck to all the team members, and once again wish them very, very happy Independence Day. Thank you very much. Thank you. Thank you.
Thank you so much, sir, for your words. And we feel very honored to have you as our chief guest. Next, I would like to introduce our speaker as well as Principal Head of Orbit Institute of Applied Homeopathy, Dr. Shilpi Arora. Dr. Shilpi Arora is a highly qualified, experienced homeopath. She completed her BHMS from highly reputed college, National Homeopathic Medical College, Lucknow. She also completed her MD in Alternative Medicine, Kolkata, as well as her post-graduation in Hospital Management from Symbiosis Institute, Pune. So I welcome you, ma'am, and I pose the session to you. Please proceed.
Thank you, Dr. Shanvi. Thank you, Dr. Arora. I'm really obliged to have you as our chief guest here. And thank you for such an inspiring speech which you have given. It will definitely motivate us and will help us move ahead in giving the best in this course. Now, I would ask, first of all, I would say Happy Independence Day to one and all present over here. It really gives me an immense pleasure to introduce you all to first of the online course which our institute OIAH is gonna present here. The topic, as you all are aware, is polycystic ovarian syndrome. So during this whole session, we'll be telling about PCOS. But before that, I would like to introduce you all to our faculty members. So we are having first, the person who does not require any introduction, that is Dr. DeepakSharma. Dr. DeepakSharma is the founder director of our Orbit Clinic as well as of our Orbit Institute of Applied Homeopathy. And he does not require any major introduction to be given, but still I'll be very happy to tell a few words about him. He is a very, very down-to-earth, very, very good practitioner. He is an international speaker in various courses, various communities he has been associated with. And he has always taken a special interest apart from his medical background in teaching. He is a guide to many junior students whom I have met and whom I have spoken to. He is not only giving the best in his practice, but he's also working as an associate professor in one of the department of pediatrics, where he has done his MD as well in pediatric thing. He's working there as an associate professor since few years. That college is in Agra. He has been associated with one of the few very much renowned organizations like WHO, or it is also like HWC. He's also working as a chairman and secretary of DHME right now. He is a person to be like not spoken in just few words. So I would like to just have him on the mic. I would like to give the mic to him. Dr. Deepak, please.
Hello everyone. Namaskar to everyone. So thank you, Dr. Shilpi, for such a big introduction to me. But still, my short introduction is I am just a student of homeopathy, and I am assuring you, all of you who is joining our course, that we are trying to give you the best from our faculty and best about the topic. So thank you, Dr. Shilpi. Go ahead and proceeding about the courses and the faculty members introductions. Thank you.
Thank you, Dr. Deepak. Now, next is myself. Dr. Shanvi has already told, so I'll just skip my part. I'll go to our next faculty member, that is Dr. Manisha Yadav. She has been my junior and she's a very, very highly qualified homeopathic doctor. Since 14 years, she has been practicing. Right now, she is practicing as a medical officer in Uttar Pradesh. She is a clinical consultant even for an online Avishkar Homeo Clinic. She has been again a mentor for many students who are giving various competitive examinations, not only related to homeopathy, but also for other science-related courses. She shows a great involvement and inclination towards teaching of the postgraduate and undergraduate students. So I would like to introduce Dr. Manisha. Can I have Dr. Manisha here?
Thank you, ma'am, for such an introduction. And good evening to all of you who have just joined this course, and hope this course will be useful to all of you. Thank you so much, ma'am.
Thank you, Dr. Manisha. Now, moving ahead with other faculties, we have Dr. Ashish Goyal, who is also a BHMS and MD in homeopathy. He is working as a medical officer again in one of the biggest state in India, that is Uttar Pradesh. He is a founder of online consultation platform, Dr. Ashish. He has, by his great immense knowledge of materia medica, has treated many difficult cases, and he is one of the favorites of the doctors over here in his area. He has handled many chronic cases, and along with that, he also shows some inclination towards teaching in the various seminars and all, and we have heard a lot about his mesmerizing materia medica knowledge. So he'll be telling us about his materia medica knowledge related to PCOS. Dr. Ashish Goyal, can I have you here?
Yes. Hello, everyone. Thank you, Dr. Shilpi. And thank you, VPS Arora, sir, for his motivational speech for us. And welcome to all of you in this institute. And I hope that everybody will enjoy this institute. And I will discuss about the homeopathic medicines here, which I am enjoying since 20 years with this homeopathic medicine. And I hope that you will also enjoy this. Thank you.
Thank you, Dr. Ashish. Then we have our very favorite Dr. Ashish, Dr. Shweta Singh. She is a highly qualified MD homeopath. She is, you can say, a multitasker. She is working as a senior research fellow member in the CCRH in the headquarters of Delhi. She is also working in the field of drug de-addiction. She shows an immense inclination towards teaching, and she has been worked as a post-assistant professor in some of the reputed medical college. She shows her inclination towards the miasmatic approach of the diseases, as hence she has done her MD in Organon of Medicine. Can I have you, Dr. Shweta?
Thank you so much, Dr. Shilpi, for this huge introduction, and welcome all of the participants here. It is very delightful to have you all here, and I'll be discussing about the clinical application of organon in the cases of PCOS. So I'm hoping for a wonderful journey with organon. Thank you. Thanks a lot.
Thank you, Dr. Shweta. Then we have our very sweet Dr. Sakshi Gupta. She again is a very upcoming booming doctor in homeopathic field. And many of us know her through the way she presents her cases and other things. She is a learned homeopath and she is a very good counselor as well. She has been our helping hand in many areas. She might be there as in the background, but she's the one who has helped us in many fields. Dr. Sakshi, can I help you?
Thank you so much, ma'am. Good evening, everyone. I would first like to thank Dr. Shilpi and Dr. Deepak. It feels like an immense pleasure to be a part of this institute. And apart from that, I'd like to congratulate everyone, as everyone of us have already welcomed you all. So I would like to congratulate every one of you in advance that you will be having a wonderful learning with this institute in this commonly encountered complaint PCOS. So thank you so much. Thank you, ma'am.
So now I would like to take the mic to myself, and I'm the speaker today. I'll be explaining and giving introduction about the topic which is to be discussed in this whole course, that is PCOS. Now, so let me first.
May I leave now?
Yes, sir, you can. Thank you. Thank you for being a part.
Yes, sir. Thank you.
Okay, once again, congratulations and wish good luck. Wish you good luck. Thank
Thank
you very much.
Thank you, sir. Thank you so much. So, Dr. Shilpi, I think you just told about the 5 days and the off of Saturday and Sunday.
Yes.
And then
fine. So let me just tell you about like what we will be doing in this whole course, so that all of you have it in mind and you can all prepare about accordingly. So day 1, which is today, we will be having the introduction, as we all already did. Then we'll be discussing about anatomy and physiology about the ovary and the organs which are involved. Plus, we'll be discussing few major FAQs related PCOS, which many people are having in their mind. Second day, which is tomorrow, that will be mainly related to what is the etiology, what's the pathology, what are the major clinical symptoms of PCOS. That all will be discussed by our speaker, Dr. Manisha Yadav. Day 3, that will be on Wednesday. That will be by Dr. Shweta. She will be telling us about the miasmatical approach and the various applications of organon in treating the cases of PCOS. Day 4, that is on Thursday, that will be handled by Dr. Ashish Goyal. He will be telling about the materia medica, that is what all major medications has been used in treating the cases of PCOS, and many of the questions which many students and people have related to that will be discussed in that day 4. Day 5, that is on Friday, which will be case discussion by Dr. DeepakSharma, and Dr. Sakshi will be assisting him in telling about the management of the cases. Apart from homeopathy, what all other things can be done for management. Saturday, Sunday will be off. We won't be having any discussions of the classes on Saturday, Sunday. Day 6 will be on next Monday, where we will be having again few case discussions by Dr. DeepakSharma, and we will be having a questionnaire session. Questionnaire session, that means based on what all you have heard in the whole day 6, all 6 days, plus whatever questions you have, whatever doubts have been cleared. On that basis, whatever we have made small questionnaire, so that we get to know by the end of the day that how much you all have understood. Still, there is something which is remaining. That will be handled on day 7, which is not an online session like this. It will be a live session by Dr. Deepak Sharma from his clinic. He'll be discussing few cases and clearing all your doubts. That will be a live session. For that, it will be a separate thing that will be discussed by Dr. Deepak at the end of the day 6. He will give the information about what and how day 7 will be going ahead on day 6. Fine. Is it okay? Everyone understood? Any doubts, anything anyone is carrying? See, I would like to tell you about this courses. How is it different from the other courses which have been running? I am not criticizing any course. I'm just telling the benefits, what you will be getting from our course. That is, since it's a live course, it's a course in which you all are given the mic. Whatever doubts, whatever things are there in your mind, please feel free. We all faculty members, not only the speaker of the day, all faculty members are there to clear your doubts. So I'll be starting this course with one of the such FAQs, which once we started this publicity of this course, when many of the people approached us, few students of mine, they asked, what is PCOD? What is PCOS? Is it one and the same thing? This is what even I had a question when I started my practice. Because when we are learning the theory part in our college, we are not exposed to that much of the practicals. So sometimes we used to know that the terminology was PCOD, and sometimes we used to use PCOS. So are these synonymous terms or are these different? So basically, I like to tell that these two are not same terms. They are completely different. PCOD is something which is a temporary phase in the body, and PCOS is something which is happening. It's a metabolic disorder which does not involve only the ovary or the female reproductive system, but involves many other areas of the body. Like it even causes a high chances of, it increases the chances of diabetes, it increases the chances of many other issues which can happen in the body. That's why the name is given as syndrome. So PCOS is a syndrome in which there is a lot of hormonal imbalance over a period of time. It does not happen just in a day or in a month cycle, that some imbalance happened and the female can have PCOS. Whereas when we talk about PCOD, it's a temporary medical condition which can happen because of many reasons, like stress, taking some kind of OCPs, taking some kind of other medicals, other drugs, can be because of the some kind of stress which the female is undergoing that time. It's just a temporary phase in which, because of slight hormonal imbalance, the rupture of the egg, the rupture of the Graafian follicle does not happen. As a result, that follicle is having some fluid accumulation in it, which gives the appearance of cyst in the ovaries. Because of that, many Graafian follicle will be converting into cyst, but the number is not that huge. Because of those cyst development, the ovary might become little enlarged. Normally, in majority of the cases, this PCOD condition is temporary, as I said, and it resolves within 1 or 2 cycles of the female. If not, then some medicines have to be administered. So basically, when we talk about PCOD and PCOS as a difference, PCOD is a very common disease which is seen nowadays because of many female indulging in delaying their periods because of taking the medicines, or because of huge stress, or because of many other involvements. PCOD has become a very common thing seen in the female. But as I said, it's a very self-resolving problem. Whereas PCOS is not that common as we compare the cases of PCOD. But PCOD, treatment-wise, it's really complicated and its management is little huge and lengthy. Though both the conditions might appear very similar in the symptoms, but PCOS has very severe complications because it might lead to type 2 diabetes. It might lead to heart disorders, high blood pressure, and even the cancer of endometrium in the uterus, but in the later stages, not in the early stages. Whereas PCOD is easily manageable. So basically, these are the various few differences between PCOD and PCOS. This was one of the most common thing which usually the patient asks us when they come with some irregularity of the periods. When the periods become irregular for more than 2 or 3 cycles, they come with a doubt. Am I suffering with PCOS? Am I suffering from PCOD? So they have that doubt in their mind. So in order that we should be very particular enough so that the doubt of the patient should be removed. So I hope I was able to clear with this difference. Anyone in the speaker having any doubts, anything? No?
I have one doubt basically. Basically, most of the time we face what is basically regular and irregular menses. क्योंकि most of the time patient आके हमसे बोलता है कि we have the menses for 2 to 3 days. Sometimes they said we have the menses for 4-5 days, and sometimes they occurred like it's earlier it's 4-5 days, now it's 2-3 days. So how can we differentiate that it's a normal thing or it's a abnormal thing, and what the changes menses have been seen in PCOD?
Okay, basically you want to know what is the difference between the irregular periods. What is the actual meaning of irregular periods, right? Yeah, right, Dr. Shanvi?
Yes, ma'am.
I know because
Yes, ma'am.
in our clinical course, because since we are female doctors, we come across with many female who are coming with this complaint, and they are not able to tell us the proper history, or they themselves are very doubtful whether the condition they are suffering from should be considered as irregular or not. So to be very clear, if you talk about irregular menstrual cycle, there are 2 types of irregularities. First is we need to see at least 2 to 3 cycles in the female. In 2 to 3 cycles, what all changes should we be noticing? One is flow change. Earlier, if the female was having a flow which was more than 4 or 5 days, which is considered normal. Normal flow is 5 to 7 days. If it is happening less than 3 days, or it is happening more than 7 days, 7 to 8 days, that will be considered irregular. Second is the irregularity is considered in the days. Normally, it is said that the cycle should be of 26 days to 35 days maximum. If it is happening less than 26 days, or you can say 24 days, that is considered irregular, or it is happening late, delayed by more than 7 to 10 days, what she used to usually have. That is called as irregular menstrual cycle. Yes, any of the faculty members would like to add upon this irregular menstrual cycle, whatever they have come across in the cases? Dr. Deepak, would you like to add upon this?
Yes, you are telling about the irregular menstrual cycle, and this is a very perfect definition you already given. But here is one more thing I want to add, that if a person or if a lady is coming with the cycle and she is telling that I am getting my cycle in 52 days. Okay. It is not an irregular cycle. If she is always having this type of pattern that in a 52 days, then this is not a irregular cycle. The irregular menstruation cycle means that if she is having in a period of 28 days, and the next one is in the 36 days, and next one in the 52 days, and next one is again in the 20 days, that shows the irregular pattern. That is called the irregular menstrual cycle, according to the latest definition from the UNESCO.
Okay, fine. So I hope Dr. Shanvi, you are able to relate it. You have any other query in this?
No, ma'am. It's clear. Thank you.
Fine, sure. So let me go back to my topic of now. As I said, we have to discuss about the ovary functioning, ovary anatomy and physiology. So this is how our ovaries actually look like. When we see a very minute microscopic description of ovary, this is how our ovaries will be looking. So we can see there are so many things here like primary follicle, developing follicle, early corpus luteum. So many things have been mentioned here. Let me go one by one explaining what our ovary is. So when we talk about ovary, what is actually ovary? How do we define ovary? Ovary is the primary female reproductive organ. Now, what is the meaning of primary organ? What is actually a primary organ? Why not uterus a primary organ? Why is not the fallopian tube the primary organ? So primary organ should have two things. First thing is primary organ is the one which releases the gamete which is needed for reproduction. And second is it releases the hormones which are needed for the same. And ovary does both the things. Since ovary is doing both the things, we call it as primary organ. So ovary is the organ, is the part of the female, that major part of the female reproductive system where eggs are stored and where female hormones are manufactured. What are the two major female hormones we have? We have estrogen and we have progesterone. Now, when we talk about estrogen and progesterone, these are the two major hormones which are causing mainly the reproductive cycle to happen properly, mainly the menstrual cycle to come regularly. All that is dependent on estrogen and progesterone. Since these are dependent on estrogen and progesterone are dependent on two major hormones which are released from pituitary. From the anterior lobe of pituitary, a small gland which is present in our brain, there are two major hormones released which are called trophic hormones. These control the functioning of the Graafian follicle which release estrogen and progesterone released from corpus luteum. So first of all, let me introduce you with all these terms which I have been using. I know majority of you know that, but still as a brushing up of a knowledge, we should just keep brushing our old knowledge which we have just dumped. So this is how the ovary is. So you can see here, this is a posterior view of the ovary. This is the ovary which is attached to the broad ligament, which is the part, the attachment of the uterus. So this ovary is attached to the broad ligament of the uterus by a peritoneal fold that is called as mesovarium. Now, only with the help of mesovarium, the ovary cannot remain attached. So it is using two more attachments to the uterus. One of them is someone says that my screen is not visible. Is it for everyone or everyone is able to see my screen?
No, it's visible.
It is visible.
Okay, fine.
No issues.
Okay, fine. So we are having one attachment of the peritoneal fluid, peritoneum is by the mesovarium. And the medial attachment of the uterus, of the ovary with the uterus is by the ligament which arises from the ovary. And the lateral end of the ovary is attached to the fimbriae of the uterine tube. Fimbriae is that place which picks up the ovules, which the Graafian follicles will be releasing. Those ovules are picked up by the fimbriae. These are the major anatomical structures that we should be aware of. Now, what is the size of the ovary? As seen in the picture, what can you make out what the size of the ovary is? So to talk about the size of the ovary, shape is like an almond, but the size is about 2.5 centimeter in length, around 1.25 centimeter in breadth, as well as 1.25 in the width, height also. So why we should know these parameters? Like if you compare in the inch wise, this is 1 inch, this is 0.5 inch, this is around 0.5 inch. This is the regular size of the ovary. So if the regular size of the ovary we know, we can tell about the abnormal size enlargement or shrinking of the ovary when we get the cases, when we get the ultrasonography report. So the normal size of the ovary is 2.5 centimeter, 1.25 and 1.25 centimeter in length, breadth and height. Now, but the size can vary. Slight variation of the size is possible based on the structure of the female, based on the build of the female, based on the age of the female. Like in the menarche condition, that time the ovary size is little smaller and it grows as the reproductive age advances. Now, the now, can you guess what is the event shown over here? I have mentioned here event A. Can anyone tell what is the event being described about? I want the answer from the people who have joined as the participants. I want a little interaction from them so that if they are having any doubt, anything coming in their mind, we can clear it that time only. Development of ovary, egg inside ovary. Okay, can you be more precise, quite near to it? It's not the development, it is what is the event A shown? Yes, anyone else from this?
Maturation of the egg.
Maturation, okay. One more very popular term we use very often. Correct. That is ovulation. Dr. Sakshi Gar, very correct. This is called as ovulation. Now, this is what is the main thing that we should be considered and discussing in the ovary. So ovulation is one of the major event of the ovaries. Now, what is ovulation? Ovulation basically is nothing but the release of the ova from the matured Graafian follicle. Now, if we come to a more precise discussion, in a male, the gamete production happens after puberty, but in female, it's not the case. In female, what we have is the production of the egg begins in the fetal life itself. If I tell more precisely, if I say not fetal life, in fetal life, we have that 280 days of gestational period in that when. So to be more precise, when the fetus is 25 weeks old, that is when the Graafian, that is when the ova starts developing. So what basically happens is we have some particular cells which are called as germ cells. Those germ cells, they will be migrating in the ovary during the early embryonic life, so that by the end of the 5 months of gestational period, the ovary contain almost, the meiosis has happened and almost 6 million ovules, ova are there. But 6 to 7 million ovas, they don't reach to the ovaries, they don't remain in the ovaries. By the end of the birth of the child, these have reduced. They reduce to a considerable number by the process which is called as apoptosis. That is called as programmed death. So by puberty, when the first menstrual period occurs, the number of egg is almost left only to 2 to 4 lakh. But we don't release 2 to 4 lakh of egg ovas in our reproductive cycle. It's only on an average 3 to 500 eggs which are released during ovulation. So what basically happens during the time? What happens to these eggs? So we should be very much clear about the ovulation. So basically, when the ovulation is happening, every menstrual cycle, we will be having almost 15 to 20 Graafian follicles trying to mature every month. But only one of them is successful enough to release the ova. That is what I had shown in that diagram. If you can see, there are many stages through which the follicles are growing. Finally, one of them is leading to the formation of the ova. And when the ova is released, the other parts of the Graafian follicle which are remaining, they convert to corpus luteum, which is having a cycle or maximum lifespan of 12 to 14 days. And during this time, it prepares the female uterus for the upcoming pregnancy, for the development of endometrium. But that's not our discussion. Our discussion is mainly on ovulation. So basically in PCOD, what will happen? This event A will not occur. When event A does not occur, this will remain inside, and as a result, it will slowly fill with the fluid and will become hardened fluid-filled cyst. This is what we call as the cyst. So I hope any doubts? Am I clear with whatever I've explained? Anyone having any doubts coming up in the mind?
Ma'am, can you please explain the sequence of follicular growth in ovary?
Pardon me, Dr. Sakshi. Sequence of?
Follicular growth in ovary.
Okay, you mean to say like what are the stages through which the follicle undergoes, right? Okay, fine.
Yes,
sure.
Yes, ma'am.
Okay, thank you. So basically we can say there are 5 to 6 stages I can relate to. Let me just write point-wise. Point 1, that is the first stage of the follicle, which is called as primary follicle. Second stage will be of secondary follicle. Third stage will be of vesicular, or we also commonly called Graafian follicle. So from first primary follicle it goes to secondary follicle. From secondary follicle, it comes to vesicular, which we call as Graafian follicle. From Graafian follicle, it becomes ruptured, and that process is called as ovulation. After ovulation, we have corpus luteum formation. And corpus luteum, this is the 5th one. And then finally, the last stage is corpus luteum degeneration. These are the 5 events. Now, it's not only the names that we should know. What actually is a primary follicle? Primary follicle contains primary oocytes. These oocytes are those cells which will be undergoing meiosis to form the ova later on. So basically, these oocytes are diploid in nature. They are not haploid. They are having 46 chromosomes. They are not having 23 chromosomes. Now, they do produce some hormones, but it's only the estrogen which is produced from the primary follicle. There is no development of progesterone from the primary follicle, and this is when your fetal life is taking place. Later on, in the fetal life only, these convert to secondary follicle. That is when the meiosis takes place and it produces the secondary oocyte. Now, this secondary oocyte is haploid in nature. That is when we say that the meiosis has happened. It has produced the haploid nature, and it produces both the hormones, estrogen and progesterone. But estrogen is more, progesterone is quite less. After that, it remains suspended, and it will be becoming Graafian follicle after puberty stage. This is also called as vesicular stage of the follicle, also commonly called Graafian follicle, in which it will be having the ova after undergoing the meiosis stage. But still, the meiosis is not complete in this. Final meiosis That is, the last stage of the meiosis will happen only after fertilization. Once the ova has become quite mature and the Graafian follicle has been matured enough, then it releases the ova, and that process is what we call as ovulation. And as I mentioned earlier also, it leads to formation of corpus luteum, which produces more of progesterone. If within 12 days no fertilization happens, the corpus luteum degenerates. Dr. Sakshi, was this the one which you were asking or something else? I hope I explained what was asked.
Yes, ma'am. Thank
Yes?
you so much.
Okay, fine. Thank you. Okay. Anyone else having any other doubts? Now I'll come to one more question which is asked to me by a few of my patients who have been coming. Can a female having PCOS conceive naturally? Now this question, I want Dr. Deepak to have a little bit of discussion on that. Yes, Dr. Deepak, can you tell? Have you come across some patients who have asked this question to you? I know you have, we have been discussing this in our orbit clinic. So can you throw a light on that?
We still have 2 or 3 patients which actually does not need any treatment for the infertility. Even the female is having the PCOS. So what we are understanding about the PCOS in this whole session, this is actually not a syndrome which is you are reading into the books, and the practical things and the theoretical things are a little different. So yes, the PCOS patient is one can conceive very naturally, but this need the perfect ovulation study, and many of the females is having the normal ovulation, but still having the PCOS in the investigation. So it is depending on the quality of the ovulation and the timing of the ovulation of the female. So it can be happen.
Thank you. So the answer for that would be yes. Having PCOS does not mean that a female naturally cannot conceive. Now, to explain this, there is one word which we very commonly use, and we have, like, if we go through the theoretical definition of PCOS, we see that it is a condition when the androgens increase to a considerable level in the female. So what basically is androgen? Does a female has androgen or no? So androgen basically is that category of the hormones, or you can say that category of sex hormones, or the hormones which are involved in the reproductive cycle. Mainly they are steroid in nature. Yes, no doubt they are produced more in the male. The main androgen which we know is testosterone. But that's not the only androgen. We are having many other androgens present, like we have androstenedione. That is another androgen which is secreted. Apart from that, there are few more androgens. Let's not go into the depth of that. So these androgens are released even in the female. Now, when the condition, a female is coming, when the PCOS is there, if we are able to reduce the androgens by the medicine, by the other managements, we will be able to make or help the female that she can conceive naturally. So these androgens are produced mainly in the male, but apart from that, even from the ovary, 40 to 50% of the androgens are released from the ovary. So in a female also, these androgens are present. In every aspect of life, there will be some or the other androgens present, but the amount of the androgen present, how high they are, how less they are, that decides whether the female will be having the ovulatory cycles or anovulatory cycles. So proper guidance about the management of it and the disease and the medicines related to it will definitely make it happen for that female. Now, this is how the ovule looks like. Now, as I said, in a month, how many follicle ruptures? So by that fact that there are tons of eggs which do not reach to the first stage. That is, there are so many follicles being maturing every month, but only one is successful, remaining all are reabsorbed and they degenerate. That process of dying of the immature Graafian follicles that they get reabsorbed, that process is called as atresia. So basically in a month, almost close to 1,000 of the eggs are lost, and the process accelerates as our age approaches towards the menopause. So now many questions, but we will ask all these later on. Is there any question from the audience side which they would like me to answer, or should I go ahead with my slides? Any other question, anyone? Okay, one more question which my patients have been asking me related to PCOS is, will the symptoms of PCOS go away as the menopause is approaching? Now here the answer would be very diplomatic answer. We can say yes, we can say no also. Now PCOS affects not only one part of the body, it affects many systems in the body. As I mentioned in the previous slide, that the risk of having diabetes, stroke, heart attacks increases with the age, as well as increases if the PCOS condition is there in a female. By the time the female reaches the menopause, there are high chances. Okay, I have one question which I'll be answering after I explain this. So PCOS related issues definitely can become better as the female approaches her menopause, but the condition again is depending on how much androgens are active in that time. Also, what is the state of her mental well-being? What is the state of her physical well-being? Is she having any other health-related problems? If diabetes and hypertension are associated with it, then the chances of reduction of PCOS declines. So it is something which we have to be very diplomatically answering the patients. Yes, it can reduce if you maintain a very good lifestyle, but it's not necessary that it will go 100%. It all depends on what kind of lifestyle we are adopting. Now, one question which I have is from Dr. Guneet Pal Singh, how to manage painful menstruation in PCOS? Very good question. Can anyone answer this? Would you like to answer, anyone? Okay, basically, yes. Dr. Abhishek.
Ma'am, for reducing the cramps, the females are advised to take milk with haldi or any hot pack in the lower abdomen area. Hot pack application.
Yes, very good. Thank you, Dr. Abhishek. See, definitely, yes, there are many home remedies which are available for avoiding the pain that is called as dysmenorrhea, that is painful menstruation. Not only we have home remedies like taking hot milk with turmeric, or giving hot fermentation to the female, or making them have a loose clothing, asking them to advise not to have any type of oily and junk food during that time, have little activeness in their daily plan. All these things from a proper management side can help in reducing the pain. Whereas we have in homeopathy, many medicines are there which are helpful in painful menstruation, which I know Dr. Ashish will be discussing in his slides on the day 4 of our program. So I think he will be the best person to answer this. I don't want to go ahead in the discussion of medicine over here. And the next question we have is from Dr. Shanvi Yadav. That is hemorrhagic cyst same as PCOD? So I would like to answer that. Hemorrhagic cyst is nothing but when the vesicular, when the blood supply or when the vesicular arrangement in the Graafian follicle is more than the usual. That is when, and if the ovulation does not happen and the vascular growth is good, that time it converts to a hemorrhagic cyst. Fine. We have Dr. Guneet Pal Singh telling that he has been using Thalspy mother tincture and it has given good relief to the patient. Thank you, Dr. Guneet, for such a good reference of the medicine. I think everyone will be benefiting from that. Okay, so now we have one more question. Cold foods can aggravate the pain and cramps. Yes, definitely cold food and the cold items like ice creams, having ice, all these things definitely elevate the pain, even the cramp. And that's why we recommend giving the hot fermentation to the female, using the hot food. All those things will be definitely relieving it. Yes. So now I want our founder director, Dr. Deepak, to go ahead and giving his advice related to all the questions asked.
Yes. Thank you, Dr. Shilpi. Now, the question is, what are the medicines are useful in to the cramping or the painful menstruation, right? So
Yes.
for that, you should know about the pathology. You should search the pathology, what is actually the behind it. And in homeopathy, there are 3 most common reasons you need to find out the 3 stages, like what the female is feeling before the menses and during the menses and after the menses. These 3 symptoms are very marked in each and every medicine in homeopathy mantra medica. Yes, yeah, Dr. Ashish will tell very much about these aggravations and aggravation. But you cannot use the single medicine like Dr. Guneet Pal is saying the therapy. Yes, for the therapeutic purpose you can use, but that is not only the role of therapy basa. There are many more medicines are there. Even if you are you know about the pathology, you can manage it by the placebos or the Rubramed we are giving. So yes, the question from the Abhilasha, the cold food can aggravate, but it never be true. Many of the female is coming with the icing. If she is doing the icing during the pain, then she is getting the relief, and that is the magic of homeopathic medicines. That we have the concomitants, we have the aggravation and amelioration symptoms like that. So it cannot be about the role of cold food. Yes, many of the females are coming with, like the phosphorus is coming with the desire of cold food, and she is having the amelioration with the cold food. So it does not mean that cold food always aggravate the pain. Yes, many times it aggravates, but not always. So you should know about the pathology. You should know about the exact symptom of the medicine. That is why the homeopathic is winning from the other stream of medicines. So do not consider about the single medicine that we learn from the profession.
Yeah, definitely. That is what the magic of homeopathy is. We have to consider many things as guiding symptoms, as the leading symptoms for the choice of the medicines we have. Okay, now we have one more question. Before we end the session, I think we'll consider this as a last question. Dr. Akanksha Chauhan has asked why leukorrhea is also associated with PCOS. Yes, Dr. Deepak.
Yes, leukorrhea is an actually a normal condition, and when the leukorrhea is infected, like the color is the curd like, and the color is green, or color is a yellow, or color is the dark brown, or it is coming with the itching and coming throughout the month, then it is abnormal. But in PCOS, you should need to understand the pathology of whole uterus. Like that, if डॉक्टर शिल्पी, अगर आपके पास वो पावर पॉइंट है, जब मैं एक बार एक ओवरी को एक्सप्लेन करना चाह रहा हूँ, आप बैक करेंगे तो।
Which one?
आपने एक ओवरी के पार्ट में,
This one?
नो, जहाँ पे यूट्रस और जो अभी इमेज थी, जो लोग हिंदी समझ सकते हैं, मैं उसको हिंदी में एक्सप्लेनेशन करता हूँ। डॉक्टर से, हाँ ये वाली देखिए, मैं डॉक्टर शिल्पी आप इसमें एक दो लोगों को समझा देना, बाकी मैं आपको एक अच्छे से एक्सप्लेनेशन देता हूँ कि जब भी कभी ईश्वर ने इस स्ट्रक्चर को बनाया होगा, तो आप इस स्ट्रक्चर में देख रहे होंगे कि ये ब्रॉड लिगामेंट से अटैच है एक ओवरी, और उसके ऊपर ही एक ट्यूबल स्ट्रक्चर है जो आगे जाकर के एक फिम्बरी में कन्वर्ट होता है, एंड द स्ट्रक्चर इज लाइक दैट। ओके, मतलब फिम्बरी जो है हमेशा ओवरी को जो है स्टिमुलेट करती है किसी ओवुलेशन के लिए, और एक पर्टिकुलर स्ट्रक्चर है। अगर ईश्वर चाहता तो एक डायरेक्ट एक कनेक्शन दे देता ओवरी टू यूट्रस, मतलब जहाँ पे पूरे इस ओवा को ट्रेवल ना करना पड़ता इस ट्यूब के लिए, और वो चाहता तो यहीं से एक ऐसा ट्रैक बना देता जो सीधे डायरेक्ट ओवा जो है वो ओवरी के थ्रू यूट्रस में इम्प्लांट हो जाता। लेकिन उसने ये बहुत अच्छे से प्लान किया कि जब स्पर्म को यहाँ से यहाँ तक आने के लिए मेहनत करनी है, तो ओवा को भी बिल्कुल सेम वैसे ही मेहनत करनी है, उससे ज़्यादा करनी है। तो ये एक बहुत ही बड़ी फिजियोलॉजिकल कंसेप्ट है जिसको हमें समझना पड़ेगा अगर हमें पीसीओएस को समझना है तो ये जो ओवरी है, जब भी कभी इसमें से ओवुलेशन होता है, तो आप लोगों को एक बात बता दो कि ओवरी में कभी भी कोई एक पॉइंट फिक्स नहीं होता जहाँ से ओवुलेशन होगा। उसके डिफरेंट पार्ट होते हैं, एंड दैट पार्ट इज डिसाइडेड बाय द अटैचमेंट ऑफ द फिम्बरी, मतलब जहाँ पे फिम्बरी अटैच होंगी और जहाँ पे ओवरी को टच करेंगी। ये मैं इसलिए एक्सप्लेन कर रहा हूँ कि जब मैं अपने केसेस के बारे में बताऊंगा तो आप लोगों को ये पता लगेगा कि मैनेजमेंट का क्या रोल है, एक्सरसाइज का क्या रोल है, और जो वाइटामिन है उसका क्या रोल है। जहाँ पे ऐसे केसेस हैं, जैसे मैंने अभी आपको जिक्र कर रहा था कि बिना मतलब पीसीओडी होते हुए भी इनफर्टिलिटी हुई है, वहाँ पे सिर्फ हमने एक्सरसाइज और मैनेजमेंट काम किया, वो ठीक हो गए। तो ये जो एक ट्रैक है ना पूरा का पूरा, ये बहुत छोटा सा ट्रैक नहीं है, इसको बहुत बड़ा रास्ता है। आप सोचो कि फिम्बरी होते हुए, अगर आप मुझे अलाउ करेंगे तो डॉक्टर शिल्पी में छोटी सी वीडियो शेयर करना चाहता हूँ जिसमें इसके बारे में सब कुछ एक्सप्लेन हो जाएगा। मुझे लगता है वो सबको एक छोटी सी वीडियो देखनी चाहिए।
Sure, I will just let you share. You can share your screen.
ये न्यूक्लियस मीडिया की एक छोटी सी वीडियो है ओवुलेशन के ऊपर ही। ठीक है, अंडरस्टैंड। ये हो क्या रहा है, मतलब जब ये ओवुलेशन हो रहा है तो आप सोचिए कि ओवुलेशन होने से पहले फिम्बरी एक स्टिमुलेशन देती है ओवरी को, और एक पर्टिकुलर पार्ट से ओवुलेशन होता है। अब आपने देखा कि अब ये जो ओवुलेशन हुआ इसको फिम्बरीज ने कैच किया, अंडरस्टैंडिंग। इस ये बहुत काम की चीज है पीसीओएस में। अगर ये फिम्बरी किसी वजह से कैच नहीं कर पाए ओवा को तो क्या होगा, कोई मुझे बताएगा मेरे स्टूडेंट्स को छोड़ करके। अगर ये ओवा पिकअप नहीं हुआ, फिम्बरी ने पिकअप नहीं किया, तो होगा ये कि जो ये ओवा रिलीज हुआ है, और ये हमेशा फॉल्टी ओवुलेशंस में होता है, अगर ये रिलीज नहीं हुआ तो ये कहाँ जाएगा, इट लाइज इन द पेरिटोनियल कैविटी। और इस पेरिटोनियल कैविटी में वो जहाँ पे भी लाई करेगा, तो ओवुलेशन की एक खास बात है कि जब ये कभी ओवा जाएगा तो इसकी एक खास बात है कि ये हमेशा एंडोमेट्रियम को सर्च करता है सेटल डाउन होने के लिए, या कोई ऐसा स्ट्रक्चर जहाँ पे कुछ उसको बेड मिल जाए। और जब ये ओवुलेशन हुआ, मतलब ओवुलेशन तो हो रहा है, ओवरी कर रही है, लेकिन फिम्बरी जो है वो पिकअप नहीं कर पा रही है। तो और जो ओवुलेशन के बाद जो ओवा जा रहा है वो यूट्रस के बाहर कहीं इम्प्लांट हो रहा है, तो वो क्या बनाएगा वहां पर, एंडोमेट्रियोसिस। ओके, और इस कंडीशन को हम लोग क्या बोलते हैं, एंडोमेट्रियोमा। मीन्स कि बहुत सारी ऐसी पैथोलॉजी की बुक ये लिखते हैं कि एंडोमेट्रियोमा का जो कॉज है वो अभी भी स्टिल अननोन है, लेकिन जो लेटेस्ट बुक हैं, जो लेटेस्ट थ्योरीज हैं, वो अभी भी ये मानती हैं कि वो जो ओवा है जिसको फिम्बरीज पिकअप नहीं कर पा रही हैं और ट्यूब पिकअप नहीं कर पा रही हैं, वो जाकर के कहीं लाई करता है, और जहाँ पे जाकर के वो लाई करता है वो कंडीशन वहाँ पे अपने ओवा जो है एक कंडीशन बनाता है जहाँ पे एंडोमेट्रियम अपने आप ही डेवलप होती है, जिसको हम लोग पैथोलॉजी में एंडोमेट्रियोमा बोलते हैं, और ये भी पेन का ही कारण हो सकता है। अभी जो बात आई थी ना कि पेनफुल मेंस्ट्रुएशन होते हैं पीसीओएस में, तो जब भी कभी पीसीओएस का पेशेंट आएगा उसका जो कॉज होगा तो हमेशा एक टीबी टेस्ट करा के जरूर देखना चाहिए, नहीं तो एमआरआई करा के देखना चाहिए। मैक्सिमम केसेस में आपको एंडोमेट्रियोसिस या एंडोमेट्रियोमा का जो केस है वो आपको जरूर मिलेगा। एंडोमेट्रियोसिस जो टर्म है वो बहुत ही कॉमन टर्म है, और आजकल की फीमेल्स में बहुत ज़्यादा मिल रही है। जब हम मैनेजमेंट की बात करेंगे तो हम आपको बताएंगे कि जो फिम्बरी हैं ये कैसे काम करती हैं। आप सोचो कि जितनी भी फिम्बरी हैं ये बिना विटामिन सी के और बिना एक्सरसाइज के कभी भी काम नहीं कर पाएंगी। इसलिए हम लोग जो पीसीओएस के केसेस ट्राई कर रहे हैं उसमें हम तीन जो चार मैनेजमेंट हैं वो सब कुछ आपको एक्सप्लेन करेंगे, बताएंगे कि कहाँ पर आपको मैनेजमेंट की जरूरत है, कहाँ पे आपको ट्रीटमेंट की जरूरत है, और कहाँ पे आपको काउंसलिंग की जरूरत है। आपकी जो फिम्बरीज हैं वो डिपेंड करती हैं कि आज आप कितने गुस्से में हो। ऐसी भी हमने स्टडीज करी हैं अपने पीसीओएस के केसेस में कि अगर फीमेल को आज बहुत ज़्यादा गुस्सा आया और उसका ओवुलेशन होने वाला है तो भी शायद ओवर पिकअप नहीं होगा। ये भी थ्योरीज हैं, लेकिन ये कहीं पे भी लिखा नहीं है, हमने अपनी स्टडी की है उसमें ये सब कुछ पाया है होम्योपैथी के थ्रू। बाकी कोई और स्ट्रीम इस बात को अभी भी नहीं मान रहा है, लेकिन हमने प्रेजेंट किए हैं फिर भी। तो ये जरूरी नहीं है कि आप किसी भी एक पीसीओएस के केस में सिर्फ एक सिम्टम के ऊपर कभी भी मेडिसिन दो। ये जरूर सोचना है कि नंबर एक तो पीसीओएस कब से डेवलप हुआ है, फिर ये सोचना है कि वो पेन क्यों हो रहा है, फिर ये सोचना है कि वो ओवुलेशन क्यों नहीं हो रहा है, फिर ये सोचना है कि आखिर वो ओवुलेशन हो भी रहा है तो वो ओवा कहाँ जा रहा है। तो ये कोई छोटी मोटी हिस्ट्री नहीं है कि बस ओवा आया और फिर ने पिकअप किया और ट्यूब में चला गया, प्रेगनेंसी हो गई। ये एक बहुत बड़ी हिस्ट्री है और बहुत ही बड़ी केमिस्ट्री है, बहुत सारे साइंटिस्ट इसको अभी भी नहीं समझ पाए हैं। तो डॉक्टर शिल्पी अगर आप चाहें तो
Yes, I will explain that. I got a message from Rick saying that he has not understand a word of this, but I know we all have understood. Those who understand Hindi, they all have understood very properly. So basically, Rick, and for the other people who have not understood what Dr. Deepak was saying, I'll just in a short way tell you what he was trying to say is, in the cases of PCOS, sometimes we come across with the case of painful menstruation, and we come across with pain in the abdomen, and we come across with some abnormal discharges. So basically, why does that happen? That usually happens because the fimbri which has to take up the ova, that does not take the ova or is unable to take the ova on time. As a result, when the ova is not being absorbed by the fimbri, it results into the condition which are called as endometriosis, and it has led to many other complicated issues which happen as the case of PCOS. So that is the reason, if in case, that is one of the reason, not the always reason, that is one of the reasons why during PCOS we are having painful menstrual cycles. Or during the cycle, it was supposed to happen, but the cycle does not happen, but because of Fimri was not able to take it up. That time also pain can be one of the symptoms. Now, what is the reason of having abnormal discharges? That is because the elasticity of the cervix, elasticity of the various parts also get impacted because of PCOS. That is one of the reasons why discharge can happen. But every time the discharge should not be considered as abnormal, because sometimes we are having normal discharge even during the ovulation. Before the menstrual cycle appears, that time also we can have some kind of discharge. Even as the periods discontinue, that time also discharge can happen. Anything apart from that is considered as abnormal. So if that is abnormal discharge happening, or the discharge having some kind of blood stains is seen, that is considered, because it can be because of stress, it can be because of some hormonal imbalance. All that could be the symptoms of PCOS, but it's not confirmatory symptom of PCOS that every time a female is having PCOS, there will be white discharge. Not necessarily leukoplakia will be always associated with PCOS. That is what Dr. Deepak was trying to say. I hope, Rick, you understood.
बट शिल्पी नेक्स्ट टाइम से करेंगे कि इसमें लाइव ट्रांसक्रिप्ट का एक ऑप्शन होता है जो लैंग्वेज को कन्वर्ट कर लेगा, तो हम इसको भी यूज कर सकते हैं.
Sure, we will do that.
थैंक यू. फिर भी किसी का कोई क्वेश्चन हो तो
yeah, if anyone is there, please feel free to message us on the site as well during the course is running. The recording of these sessions will be available for 1 month on the website through your own registered ID. And if in case you are having any other doubts still, even after the session is over, feel free to approach us in the FAQ section of our website. So you can approach any of our faculty member and ask your doubts. Fine. I think we should end up the session for today. Tomorrow we'll be having the day 2. The time is same, 9 p.m. That will be by Dr. Manisha Yadav. She'll be explaining the major etiology, pathology, and the major signs and symptoms associated with PCOS cases. Right. I hope everyone enjoyed the session.
Yes, ma'am. Nicely. Thank you very much.
Yeah. Thank you, Dr. Manish. Yep. Fine.
Thank you, ma'am, for the wonderful session.
Yeah. Thank you, doctor. Fine. I hope we can end up for today. Yeah. Thank you, everyone. You all can leave from the meeting.
Okay, ma'am.